Hi, this YouTube video is for my Module 8 Pathophysiology final for Ms. Christian Warner. My name is Michelle Vaughn and today's date is March 16, 2020. I'm going to be talking about multi-system issues. I'm going to look at the objectives, and in the objectives we're going to be able to define diabetes mellitus. We're going to be able to determine its risk factors and relate the diabetes with its multiple clinical manifestations. So we're going to talk about diabetes mellitus. Diabetes is an autoimmune disease. Diabetes is a disease that affects the body's ability to use glucose. The body's cells require energy. Glucose is the main source used for vitality. Insulin controls the levels of glucose within the body. The hormone is made by the pancreas. Diabetes mellitus is a chronic disorder. It is characterized by a deficient release of insulin. This causes an inability for the cells to utilize glucose. There are two types of diabetes, type 1 and type 2. Type 1 diabetes is usually found in children or younger adults under the age of 30. However, type 1 diabetes can appear at any age. The onset comes on quickly and without warning. The person affected by type 1 diabetes cannot make insulin. They require insulin injections. This happens because the immune system destroys the cells in the pancreas that make the insulin. The end result is the pancreas stops making the insulin. Type 1 diabetes produces little to no insulin. There is no cure for type 1 diabetes. Type 2 diabetes is usually seen in people over the age of 40, but can occur at any age. It is common in people who are overweight. Type 2 diabetes is the most common form of diabetes. It is usually seen in people 35 and older. The onset of diabetes type 2 is more gradual. The person with type 2 is still able to produce some insulin. However, it does not usually work appropriately. Type 2 diabetes is linked to people who are overweight and inactive. Diabetes mellitus risk factors include hypertension, family history, race, obesity, polycystic ovary disease, and history of cardiovascular disease, physical inactivity, and gestational diabetes. Type 1 and type 2 diabetes share many risk factors. Women who were diagnosed with gestational diabetes during pregnancy are at risk later in life. Polycystic ovary disease can disrupt the endocrine system and cause insulin resistance. Obesity can lead a person to the diagnosis of diabetes because of insulin resistance. The insulin resistance triggers the person to have a high blood sugar due to glucose buildup in the body. One's race plays a role in the risk factors of diabetes due to their diet and lifestyle. Body type is also a reason. Family history is one of the most prevalent factors to acquiring diabetes, especially if it is a first-degree relative. Hypertension and diabetes have commonalities in their risk factors. They often occur together. One may even mask the other symptoms. Cardiovascular disease is also linked to diabetes. This is due to health risk factors. The more a person has, the more their chance increases. We'll talk about the manifestations of diabetes, and some include weakness, weight loss, fatigue, prolonged wound healing, polyuria, polydipsia, and polyphagia. Diabetes has many clinical manifestations. Some people don't recognize the signs because some can be so subtle. Some of the more common symptoms of diabetes include blurry vision, fatigue, poor wound healing, weakness, an increase in thirst and urination, and weight loss. In men, it has been reported that they have a decreased sex drive. In women, their skin becomes dry. They also have an increase in yeast and urine infections. Going to talk about diabetes and the renal system, and diabetes can cause kidney damage. An early sign of kidney disease is protein in the urine. The renal system is highly impacted by diabetes. Diabetes is a significant cause as to why people develop end-stage renal disease. One of the earliest signs of kidney disease is protein in the urine. By controlling your blood sugar level, you can aid in the protection of your kidneys. Diabetes causes injury to blood vessels in the kidneys. In order for kidneys to function properly, the blood vessels must be intact. When the blood vessels become injured, the injuries don't work. When the blood vessels become injured, the kidneys don't work properly. The kidneys can't clean the blood. This causes the person's body to retain salt and water. As the salt and water begin to build up, it causes the person to gain weight. They can also see swelling in their ankles. Once the blood vessels are damaged, it can cause high blood pressure. High blood pressure can cause kidney troubles as well. Adults with diabetes are at a higher risk of developing chronic kidney disease. Chronic kidney disease occurs when the kidneys are damaged and cannot filter blood appropriately. Because the filtration does not work properly when you suffer from kidney disease, it can cause waste and fluid to remain in the body. Chronic kidney disease is seen more in women than men. When your kidneys stop working, you may need dialysis. Diabetes can affect a person's lung function. The relation between diabetes and lung function is a mysterious one. It is believed that inflammation is the root cause. Diabetes can cause inflammation. When high markers of inflammation are noted, doctors link it to low lung function. When blood glucose levels are high, the lungs function worse. People with diabetes are at risk to have asthma and COPD. Ketoacidosis can cause Kussmaul breathing. The form of breathing is labored and very dangerous. This form of breathing takes place when the lungs need to compensate due to acidosis. The kidneys rely on both bases and buffers. When these become disturbed, it causes issues with one's breathing. Type 2 diabetes can cause sleep apnea. Sleep apnea is common when people who have type 2 diabetes. Sleep apnea can actually make diabetes symptoms worse. Sleep apnea can cause major fatigue and can lead to problems such as a stroke, heart disease, and high blood pressure. Sleep apnea is also linked to obesity. It causes a person to pause during breathing. It can also cause insulin resistance. Diabetes and the circulatory system. Diabetes can cause cardiovascular disease and affect the circulatory system. Poor circulation can cause issues with a person's eyes and feet. Heart complications derive from damage to the blood vessels. Blood vessels can also be damaged by a high cholesterol level. It is important to keep this level under control. When arteries and veins get clogged and damaged, it makes it harder for blood to flow appropriately. There are various ways to reduce the risk of cardiovascular issues when you have diabetes. In order to reduce your risk of cardiovascular disease when you have diabetes, you must keep your A1C, blood pressure, and cholesterol under control. It is important to eat a well-balanced diet. You should exercise regularly. If you're overweight, you should lose a few pounds to reduce the stress and strain that is placed on your heart when you're overweight. It is vital to quit smoking as well. Diabetes can cause nerve damage. Diabetic neuropathy is caused by high blood sugar levels. It can cause numbness and tingling in a person's hands, feet, toes, and fingers. The pain may start off mild but become worse over time. The pain can spread to other body parts such as the legs and arms. You cannot replace damaged nerves. It is important to exercise and decrease the blood sugar levels to a healthy range. Some people may even require pain medications or physical therapy to help alleviate their pain symptoms. ECM changes occur when people have diabetes. Extracellular matrix is affected by diabetes. One consequence that diabetes plays a role in is fibrosis and tissue remodeling. When these alterations take place, they have a direct impact on organ function. It is important to have extracellular matrix homeostasis. Diabetes changes the ECM makeup and causes organ-dependent disease. Compensation in diabetes. The body has a way in compensating for a person who has diabetes. In the body, we have several organs that perform functions for our body. When one system or body part is in trouble, other systems step up to aid in keeping the body's homeostasis. With diabetes, the body's pancreas tries to release insulin to compensate for high levels of blood sugar. This concludes my presentation. Thank you.